8,000 doses of Australia's COVID-19 vaccine supply will be sent to Papua New Guinea in response to a worsening outbreak of the virus in the country. Foreign Affairs reporter Stephen Jedgetts joins us now from Parliament House in Canberra. Hi, Stephen. So what's the government announced?
Well, the government's announced that these 8,000 doses will be sent immediately, or at least in coming days, and the focus is very much those frontline health workers who are absolutely bearing the brunt of this in PNG. Of course, we've seen a health system there under enormous strain. We've seen 114 patients in PNG's largest hospital in Port Moresby already effectively have come down with the COVID-19 strain. On top of that, we've seen a number of key institutions really struggling, and the impact that this has had on the health system has been really substantial. So the 8,000 doses will go straight to those doctors, nurses and others who are trying to stem the flow of this tide. On top of that, the government's also suspended flights with PNG between PNG and Cairns. It says that's necessary to stop the spread of the disease. It's also trying to press the European Union and also AstraZeneca to free up about 1 million doses of the vaccine that were going to go to Australia and are due to go to Australia, they've been paid for, and to send them to PNG instead. Their argument is that while you can make the argument that Europe might need those doses more than Australia, you definitely cannot make the argument that that Europe needs the doses more than PNG, because the situation there is so grave. And finally, the government's also looking at boosting PPE, that's personal protective equipment, to help the hospitals and the people working in them deal with the full magnitude of this crisis. Now, the Prime Minister, Scott Morrison, says he's doing this because he wants to help PNG, but he also says it's important to do it to stem the flow in order to protect Australia and Australians. Let's take a listen to what he had to say.
They're our family, they're our friends, they're our neighbours, they're our partners. They have always stood with us and we will always stand with them. This is in Australia's interests and is in our region's interests. And it's incumbent upon us as Australians, both in securing the health of our own citizens, but equally of our PNG family who are so dear to us.
And Stephen, what's the opposition had to say?
Well, we haven't yet heard from the opposition post this announcement, so we're still waiting for a formal response from the opposition to what Scott Morrison has said. However, for the last few days, the opposition has been pretty withering about the government's conduct here. They say it's been too slow, too tardy, too hesitant to actually deal with the crisis, and they argued that the government could have intervened earlier to prevent the health crisis that we've got at the moment from reaching the magnitude that it has. So Penny Wong, the Shadow Foreign Minister, when she was asked about this morning, she said the government hadn't acted with the sense of urgency that the situation demanded. Let's take a listen to what she had to say.
I would say the government's response hasn't reflected that clear and present danger. It has been uncertain, it has been tardy, and I would urge the government to act promptly and swiftly to provide PNG with the support, with the vaccines, with the personal protective equipment that are required.
What sort of threat does the situation in PNG pose to Australia, Stephen?
Well, Ros, the threat is twofold. Of course, you've got the immediate threat of people hopping on planes and coming to Australia. Queensland's government has already complained quite a bit about the number of cases they've had to deal with coming out of PNG and the pressure that has put on some of their facilities. And there's also, of course, as part of that, the threat that's posed by the disease across the Torres Strait. It's a very narrow and very porous border there, so the fear is that cases could effectively come through that way. But in the long term, and even really the medium term, there's also the fear of mutations in PNG. If this virus does run wild through the community for a sustained period of time, then that increases the risk that you might get a mutation which is resistant to all of the vaccines that are currently being rolled out in Australia. And if that mutation comes across the border, whether across the Torres Strait or through an aeroplane, then that does pose, of course, a very serious risk. So you can see why Australia's acting. The government clearly believes it's not only necessary to do this to help PNG, but also to help Australians as well.
Thanks, Stephen.